So in just an hour, we have Bernie Sanders announcing the introduction of his Medicare for All proposal. It is, in many respects, I think, the value of this proposal is not merely in the actual proposal itself. It is not, let me rephrase that. The value of his introduction of this bill is not incumbent upon it passing. I mean, ultimately, I'd like it to, but the value in it is in forcing other Democrats to adopt this position, not just from a policy standpoint, but from the everything that is implied. What is implied from this is that government can provide the crucial needs of its people. And health care is obviously one of those crucial needs. Government can and should provide it. And when you talk about the creation of solidarity, when you talk about the creation of community, the idea that our government would provide for the health and really, in many respects, just make the lives of its citizens that much easier is a really important concept for people to buy into. Broadly speaking, I mean, many people who listen to this show, obviously, I think fundamentally understand that. People who are on Medicare have a better understanding of that. People who, Bill de Blasio, for all his faults and for, perhaps some unrealized promise, won pretty handily the Democratic primary yesterday, which is essentially like winning. Well, I don't know if I could say that, but it is, it's going to be tough to beat him in the general election. For mayor, universal pre-K, I mentioned it yesterday. I mean, it makes a difference. And so just having the buy-in from Democratic senators, we are up to 15, and I imagine as time passes, we will see more. It expands our imagination. I mean, I don't want to get into this, but some people say this is looking for wishful ponies. Well, now it's good because now we have 15 Democratic senators, 16 who caucus with the Democrats, who are saying, you know what, we can have ponies. Ponies exist. Some people have ponies. I mean, it's not like we're saying unicorns. Nobody has unicorns. It is the case that not everybody can have ponies at this point. There are a lot of countries in the world that can't get ponies because they don't have the economic strength yet. They don't have the cohesiveness. But we can get ponies. They exist. People have them. Ponies are real, ladies and gentlemen. Contrary to popular belief, ponies are real. All right, phones seem to be back up, according to Kyle. The number is 646-257-3920. I am calling in as we speak. Bernie Sanders' plan, as it will be announced today, establishes a almost a true single-payer system. Private employer-based insurance is replaced by an expansion of Medicare to include nearly every American. It does so over the course of 4 years, Starts with lowering the Medicare eligibility age to 55 and ensuring all children, I believe, defined as under the age of 18 in the first year, and then expands the plan to include all citizens over the following 3 years. It expands on the current Medicare by including dental, vision, and hearing aids. It eliminates all copays and deductibles. It allows the expanded Medicare system to negotiate drug prices, which currently Medicare is forbidden from doing. It does not include nursing home coverage, which can be continued to be covered under Medicaid, nor does it eliminate the VA or the Indian Health Service. It would pay providers at current Medicare rates, which are lower than private insurance rates, but higher than Medicaid. So I believe, and I don't, again, we're not going to know the full details for another hour or two, but I believe it would basically make Medicaid redundant, but for providing for nursing home coverage, but I don't know that for sure. If this were to be implemented, it would be the single most comprehensive healthcare plan in the world. Sanders today wrote in the New York Times, "This is a pivotal moment in American history. Do we as a nation join the rest of the industrialized world and guarantee comprehensive health care to every person as a human right? Or do we maintain a system that is enormously expensive, wasteful, and bureaucratic, and is designed to maximize profits for big insurance companies, the pharmaceutical industry, Wall Street, and medical equipment suppliers? We remain the only major country on earth that allows chief executives and stockholders in the healthcare industry to get incredibly rich while tens of millions of people suffer because they can't get the healthcare they need. This is not what the United States should be about." He goes on to read more. You can find that at the New York Times. Dave Weigel, writing for the CIA and the Washington Post, writes, "The bill would revolutionize America's healthcare system. Everything from emergency surgery to prescription drugs, from mental health to eye care would be covered with no copayments. Everyone under the age of 18 in America would immediately obtain universal Medicare cards, while Americans not currently eligible for Medicare would be phased into the program over 4 years. Employer-provided health care would be replaced with the employers paying higher taxes but no longer on the hook for insurance." That would be fantastic. That would be fantastic. Private insurers would remain with fewer customers to pay for elective treatments such as plastic surgery, systems similar to Australia, which, coincidentally, President Trump has praised for being much better than the American system. Doctors would be reimbursed by the government. Providers would sign a yearly participation agreement with Medicare to remain in the system. As he described in his legislation, Sanders focused on its simplicity, suggesting that Americans would be happy to pay higher taxes if it meant the end of wrangling with healthcare companies. The size of the tax increase, he said, would be determined in a separate bill. He acknowledged that the plan would be costly, but pointed to the experience of other industrialized countries that provided universal coverage through higher taxes. The average American paid $11,365 per year in taxes. The average Canadian pays $14,693 in taxes, but the average American paid twice as much for health care as the average Canadian. So the idea is that the cost for the individual would net out. Net, all things would probably be equal. Maybe it'd be a little bit less in the taxes. It's not inconceivable to me it'd be a little bit more than you would pay for health insurance, perhaps. But it would be totally comprehensive. It would be totally easy. obviously, low-income people would be paying, wouldn't have their taxes raised as much. But there would be more taxes. But you would never have to stay in a job because you were afraid of losing your health care. As an employer, you would never have to fret about having to hire separate individuals just to make sure that you can provide health care, whose job it is to just get the health care to the people. Never mind what you have to pay for it. The idea of getting I got thrown into a collection agency. As I went to an emergency room. I think I've spoken about this about a year or two ago. Went to the emergency room, had a cardiogram and a blood test. Waited there for 8 hours. Got a bill for almost $2,000, which part of it was covered by my health insurance, the vast majority of it, which I found shocking that it was that expensive. And then I get a notice from a collection agency that I owe $500 to some emergency physicians, like Emergency Physicians Inc. And I'm like, what? I never got this bill. What is it? I call the collection agency. They can't even tell me who it's from. I call the hospital. They're like, oh, yeah, those are the doctors. And I was like, wait, what? I just have a bill here that says emergency room care services, and then a separate bill for the blood test. What do you mean the doctors? What were you providing me there? Well, the emergency room. So I was like, if I just literally went in there and no one provided me care, just my stepping through the door cost $2,000. Yes.
How long was your wait time?
7 hours.
Would have been like 8 if we had.
Yeah, exactly. It would have been 7.5. But, we have an effed up system. You know what? I totally forgot about that story because I didn't pay the $500 because I never got the bill. And then the collection agency never contacted me. It's absurd. I'm sick of it. Hi, folks. Sam Seder here. We still need your help on our Patreon page. YouTube ads have come back, but not nearly as much as we had before. So if you can help us out, any little bit helps. Head over to our Patreon page right at this URL, and you'll help us keep helping you by making videos